Hi everyone, my name is Ariel and I'll go over some of the clinicopathologic correlations of the musculoskeletal system. So I will go over 7, and the first one is going to be arthritis with psoriasis. So we've learned that psoriasis is a common skin disease in the US, but in 7% of patients who have psoriasis, they develop joint disease, and this can be manifested with hyperkeratosis or like hardening on an erythematous or reddening base. And the key point here is that there's psoriatic arthritis, which is asymmetrical arthritis involving 2 to 3 joints. And then there's also arthritis mutilans, in which there's it's the most deforming type of psoriatic arthritis. And in very severe cases, there's osteolysis of the phalangeal and metacarpal joints, resulting in telescoping of the digits, also known as opera glass deformity. So it kind of looks like the fingers have been pushed into the rest of the hand. Second, I'll go over plantar fasciitis. It's an inflammation of the plantar fascia caused by excessive repetitive stretching of that broad band that runs along, it's a tissue that runs along the bottom of the foot that attaches the calcaneus and the forefoot. So key here is there is pain as most severe when the patient takes their first steps in the morning or when they're getting up from a chair. And this occurs because there's that plantar fascia is excessively stretched, and then there's a lot of arch pain, heel pain, and heel spurs. And the common causes are improperly fitting footwear, overpronation, so it's a flat foot. There's an unusually high arch of the foot. The patient may have a sudden increase in physical activity, or there's excessive weight on the foot, usually due to obesity and pregnancy. Number 3 is gout. So this is high levels of uric acid, where urate crystals are going to deposit in and around the joint, and then it can develop into tophi. This is very common on the big toe, and there's a lot of pain, and it'll usually wake up the patient from sleep, but you can also see it on the finger, ear, elbows, and the Achilles tendon. Number 4 is that bunion. This is also known as hallux abductovalgus deformity. It's a frequent musculoskeletal condition with the foot with medial deviation of the first metatarsal. So medial deviation meaning that this part of the foot or that big toe moves inward, and lateral deviation of the big toe at the metatarsal phalangeal joint. So the actual toe, that this part of the toe actually moves towards the side. It's caused by forefoot abductus and excess pronation of the subtalar joint. Lots of big words. Basically means that the big toe pushes against the next toe, and it's from degenerative arthritis or improperly wearing tight shoes that causes limited motion. So bunions are very painful and can occur with patients with diabetes that can eventually become ulcerated and infected. Number 5 are hammer toes. So this is flexion contracture. So think bending deformity of the proximal interphalangeal joints of the smaller toes. So bunion, big toe, hammer toes, small toes. So basically that like your smaller toes has this bending and it stays like that. So that middle joint on the toe bends, and then you'll see hyperkeratosis. It's hardening like a corn or a callus on top. It's caused by muscle or tendon imbalance with wearing tight shoes. Number 6 are ankle sprains. So it's a common musculoskeletal injury, especially in those who participate in sports. And then lastly, number 7 is stress fracture. This is where the patient manifests with a sudden onset of pain along the midshaft of the lesser metatarsals, and this is going to require an X-ray. Thank you.